St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you to you, our viewer, for joining us right here again on our Health Talk in Capuchin TV. My name is Maureen Kimani, and you know, right here every Tuesday from 9 a.m. we bring you Health Talk from experts in St. Mary's Mission Hospital. And I'm sure you're asking yourself, why St. Mary's Mission Hospital? One, it's very affordable. Secondly, it's very easy to locate where it is, very accessible. And the doctors, the nurses are very expertise, and you can find them very friendly. And that's why we say and we recommend St. Mary's Mission Hospital is the best place to be. We don't say, no matter if you're not sick, or maybe you can even attend to have a checkup. Like last time we were talking about the dental, the breath for our mouth. You can just visit. It's very necessary to take care of our bodies, and that's why we bring you this session that is brought to you live by Capuchin TV in partnership with St. Mary's Mission Hospital. Welcome to our discussion. And today I'm very glad to be joined by one of the doctor, and he will be introducing himself, telling us what is his name and what he does in St. Mary's Mission Hospital. Welcome, Dr.
Thank you so much.
Good morning. How are you doing?
I'm doing great.
Yes, good to have you here in Capuchin.
Yeah, good
and thank you for making time.
Thank you.
Yeah, maybe you can introduce yourself to our viewer, tell them who you are and what you do in St. Mary's.
Okay, so my name is Dr. Kazoya John. I'm a consultant general surgeon at St. Mary's. I'm working in the surgical department, where our role is make a diagnosis and managing our patient. Yeah.
Mm-hmm.
So basically, I don't know if you, today, if I go to talk about this colorectal cancer.
Yes, you can use this camera right here.
Thank you.
Yeah. Before you even talk about our today's topic,
yes.
You have said your name is John.
Yes.
You didn't tell our viewer the other name, John Luke.
John Luke Kazoya.
Yeah. Sure. Yeah, one of the disciples of Jesus.
Yes.
Okay, good to have you here. And as you have heard from Dr. Kazoya, we're going to be talking about colorectal cancer. Maybe you have heard about the name cancer, but not colorectal. We shall get to know what is it all about, and some of the causes and signs and symptoms, and if it can be prevented. And in case you have any question concerning our topic today, you can send an SMS that is on our number 0717-424-866, or you can use our SMS number that is 21760. Welcome to the discussion. Yes, let's get started, Dr.
Yes.
We're talking about colorectal cancer.
Sure.
Maybe you can try and you define first what is it, what is a cancer, and later you can say the genre of colorectal cancer.
Oh, thank you so much.
Yes.
So as we said, today our topic is to be colorectal cancer.
Mm-hmm.
And if we talk about cancer, many people have heard about cancer.
True.
And there is right and wrong information about cancer.
Mm-hmm.
But if we talk about cancer, let me give you an example. In our human being, we have cells. Human beings formed by cells, many cells. And the cells, they're born after like 24 hours, 48 hours, they die. So a cancer is whereby you have the daughter cells which are abnormal, and these cells which are abnormal, they are not able to carry oxygen or to give energy. And again, there's abnormal cells, they are coming to kill the normal cells. If there is no treatment, this cancer always treat to death. Yes. This is general if we talk about cancer.
What about colorectal cancer?
So about colorectal cancer is in anatomic location in human being in our body. Let me try to go this way. Here we have
you can use that one.
Here we have a cecum.
Yes.
And here we have ascending colon. Here we have transverse colon. Here we have descending colon. Here we have sigmoid, and of course we have rectum and anus. Colorectal cancer is a cancer which is involving the rectum and the colon. This is a specific location of that cancer. Yes. Yes.
Okay, and how does this colorectal cancer begin or form?
So colorectal cancer most of the time is a a silent disease. You can even have it, then you don't have any complaint. Until a certain time, the patient will have like some clear symptoms. Otherwise, it may take 3-5 years and it is silent. You don't have nothing. You are walking, you are driving your car, you are doing your business, but still you have a colorectal cancer. Until later, it is manifested. Yes.
And who is this person who gets this colorectal cancer? Is it for both female and male, or?
Of course, I think is if we consider gender, colorectal cancer it can be to male and female, and they are at almost the same ratio. Yes.
So for both of them, they are at higher risk of having this colorectal cancer.
Exactly.
What about the age preferences?
So here we have two groups of people. We have first of all a group of people who don't have family history of colorectal cancer. This one, most likely, the cancer will happen after 50 years. Although the second group, we have a group where the colorectal cancer is hereditary, is a family disease. That one, you can be a teenager and have a colorectal cancer. Or have a 20s, 25 years and have a colorectal cancer because there is a family history of colorectal cancer. Or there is other family cancer also. If someone in the family has, like, let's say uterine cancer or bladder cancer or actually stomach cancer, it can also impact some of the family members to have a colorectal cancer at very young age. Yes.
Okay.
Yeah.
And talking about colorectal cancer, we understand that we have different cancers. We have the breast cancer, we have the prostate cancer. How is it common globally?
Normally, colorectal cancer is known as a second cancer which is leading to death after lungs cancer. So in Africa, it's very difficult to know the prevalence of the colorectal cancer because it's undiagnosed. But if you consider, like in US, they will say around 100,000 people will have like a colorectal cancer each year, a new diagnosed cancer. Yeah.
So it's very alertive when it comes to, okay, before we're going to talk about some of the causes, and noting that since you talked, it's the second leading cancer globally. So I think it's very nice we have this kind of topic or discussion to entice people and to make sure they have the right information about this cancer, and they can have a very educative session, and they can even talk to their friends just to have this information. Let's talk about some of the causes of this colorectal cancer. Maybe you can start with the main causes, and as you break down the other causes.
Yeah, of course, the colorectal cancer have some causes, and also what we call etiology, and it has also what we call risk factors. So if we talk about causes, let me say there is some infectious causes, like there is a microbe, a bacteria, what sometimes the name is Clostridium septum. This one can lead to a cancer. So there is some disease also with what we call inflammatory bowel disease, where the intestine is having like a kind of bleeding regularly, what we call ulcerative colitis and Crohn's disease. Most of the time, Crohn's disease also can lead to a cancer. This is infectious. It can also depend on what we eat. So colorectal cancer is also associated with red meat and fat. You know, people who are going to eat the red meat, at the end, it may be also the risk factor of a colorectal cancer. And also, like obese people, they are at high risk having a colorectal cancer. Another risk factor of colorectal cancer is a patient who is obese or diabetic patient. At the end, also it can make, it can also create this kind of cancer, colorectal cancer. Yes.
Okay, and what are some of the types of these colorectal cancer?
Yeah, there are many types. Let me talk about first group. A group of patients who doesn't have history of colorectal cancer in the family. So this one, we have major two type of cancer. One is what we call adenocarcinoma, and a second one, it may be what we call squamous cell carcinoma. We can have also what we call lymphoma. You can have them, or what we call G cells carcinoma. It can be there, but most common is adenocarcinoma. Yes,
quite ambiguous words.
Yeah,
the technical term that doctors use.
Yes, yeah.
Okay, and I don't know if you may correct me. I don't know if I'm right. Colorectal cancer is also called a bowel cancer.
Yeah.
Colon cancer or rectum cancer.
Oh, that's good. So if we say colon, anatomically is like a large intestine. And if we say, it means when we talk small, large intestine cancer or colon cancer is the same word. But if we say rectal cancer, is a cancer which is located in the rectum. Coming back to the previous questions, you say type of cancer. I talk about adenocarcinoma and squamous cell carcinoma or lymphoma. They commonly affect the people who don't have a family history of this kind of cancer. But we have another group, the people who have a family history of cancer. We have what we call familial adenomatosis polyposis. This is I have experience at St. Mary's, a young lady, 20 years. I did a colonoscopy, then I find many, what we call 1,000 polyp in the colon. Actually, let me show you a bit. 1,000 polyp, you do colonoscopy, from the anus, you find first polyp. It's kind of a growth, and you go all the way, there is polyp, what we call 1,000 polyp. This is what we call FAP, familial adenomatosis polyposis. This is one group. There is another family cancer. When you do a colonoscopy, you don't find polyp. Then we call them what we call Lynch syndrome. In Lynch syndrome, you have two groups, Lynch 1 and Lynch 2. In Lynch 1, a patient is having only colorectal cancer or rectal cancer, but in Lynch 2, the patient will have either this colon cancer associated with stomach cancer, cancer located in the bladder, and also in the uterus. Yeah, this is a kind of group of type of cancer we have also in a patient who has family history of colorectal cancer. Yes.
Okay. Yeah. And Dr. taking you back, you mentioned there was a case that you handled about a 20-year-old woman.
Yes.
Let's talk about some of the signs and symptoms of this colorectal cancer.
Yeah. So let me talk about first group, a patient who's more than 60, and this one doesn't have a history of colorectal cancer in the family. Most of the time, the patient will have anemia. You mean anemia? It will be kind of loss of blood. You check for blood. The hemoglobin is down. This is one sign. Other sign is loss of weight. I received a patient like 2019. He was 85 kg. Then when I received 2021, 1 year later, he was 56. And has anemia, and also has anemia, and is more than he was 56. Actually, if I see a patient who is more than 50 and he has what we call anemia, atypical anemia, what we call microcytic anemia, and he has this sort of loss of weight, and I will say this is colorectal cancer until proven otherwise. Yes. 3 signs. Loss of weight, anemia, then you are more than 50. This, it must be colorectal cancer until I do colonoscopy, I do a CT scan, I see there is nothing. But my first thinking is colorectal cancer. Yes.
And so that means, does that mean in case maybe one loses weight, what about the people who go to the gym and you find they lose even 10 kgs?
You know,
what do you have to say there?
You know, there is always many reasons to lose weight. So in this case of colorectal cancer, there is no reason. You can even starve for 2 days or 3 days, and you are on a regime, or you are doing exercises, then you lose weight. Then you are not going to blame colorectal cancer. You know already the reason of losing weight. Yes.
Okay. And before we take a break, you talked about some of the signs and symptoms. That's what we're going to talk about, the blood in the stool.
Yes.
We understand that hemorrhoids, we were talking about that last week, but when we had the same topic of hemorrhoids, has the same sign. How does one tell this colorectal cancer and not hemorrhoids?
Oh, okay. So most of the time hemorrhoid, it depends on a group of the patient. So it's very unlikely to have hemorrhoid at 60s. Hemorrhoid most common for young age. And when you have hemorrhoid, there is no history of loss of weight. Of course, you can have bloody stool. And again, someone who is complaining of hemorrhoid, he will have perianal pain, very severe pain. Yes. And also, this is when I take history of my patient. Although when I do a physical exam, I do what we call digital rectal exam. For hemorrhoid, is very external, you can see it, even without using a microscope. But for colorectal cancer, is something is very difficult to see it on a physical exam, and he will put a tube in the rectum and observe through a screen, what we call colonoscopy. Yeah. Basically, I can see at age of 20, and I ask, there is no history, family history of colorectal cancer, and you feel perianal pain even before doing exam. I say most likely this is hemorrhoids. Yes.
Very interesting.
And the outcome are different. Yeah, and the management are different.
Okay.
Yeah.
Thank you so much, Dr. Kazoya, for taking us through the first session of the introduction of colorectal cancer. We're going to take a very short break, but we will be right back with the same topic as we engage. What about this colorectal cancer? Can it be cured? I'm sure you're asking yourself. Well, we get to know, so stay tuned.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, kitambulisho Katoliki.
Welcome back, dear viewer, on our Health Talk right here on Capuchin TV with me, Maureen Kimani. And right here we bring you different experts from St. Mary's Mission Hospital. And today we are very glad to have Dr. Kazoya with us. He is the general consultant, general surgeon in St. Mary's Mission Hospital. Welcome back, dear viewer, and welcome back, Dr. Ri.
Thank you so much.
Yeah, I feel we left some part of this topic. It's very concern for people to know. What about those ones who have radiation therapy for cancers? Are they at risk of having this colorectal cancer?
Of course, yes. Yeah, let me talk some patient who has some cancer, like prostate cancer, like even rectal cancer, even gynae cancer. Gynae, I mean the cancer of the uterus, cancer involving the pelvic. Then on treatment, you do radiation therapy. Some of them, they will have also the colorectal cancer as a complication of radiotherapy. Mm-hmm. But if I say risk factor, it doesn't mean anyone who went through radiotherapy will have a colorectal cancer. Mm-hmm. No, there is a risk factor. There is some people who will be going through the radiation therapy, then we'll have a colorectal cancer as a complication, mm-hmm. as a side effect of radiation therapy.
Okay.
Yes.
Okay. Before we had gone for the break, I talked about if this colorectal cancer can be cured. But before we talk about that, how is it treated?
Yeah, I think, as you know, you may know, for colorectal cancer and other cancer, the treatment is what we call triple therapy. We have three things to do for colorectal cancer. We do chemotherapy. Chemotherapy is a kind of medication which are going to control the disease systematically, I mean through the bloodstream. And we have also the radiation therapy, which is coming to control the cancer cells on where we have a tumor. And let me show you an example. If we have a tumor of the rectum, this one we can start giving chemotherapy, then we do radiation therapy. Chemotherapy is to control the disease systematically, and the radiation therapy is local. After that, the tumor which was big, it can shrink, can be small. Then after that, we do surgery. So actually, for colorectal cancer also, we do let me say breakdown. For rectal cancer, most of the time, we start chemoradiation therapy, what we call neoadjuvant chemoradiation therapy, and surgery. But for a cancer which is located in the rectum, for example, this kind of cancer, this kind of cancer in the colon, this kind of cancer and this kind of cancer, we start surgery. Then we go for chemoradiation therapy, what we call adjuvant chemoradiation therapy. So something maybe we forgot to talk about. 70 to 75% of colon cancer is located in the sigmoid. Most of common location of the colon cancer. Yes, yes.
Okay, and since you talked about you have had some of the patients coming forward to you, can this colorectal cancer be cured, and what's the survival rate for this colorectal cancer?
Yeah, this one I think is what people need to know.
Yeah.
Because some village, when they hear someone having a cancer, they will say goodbye. But which is not true. Colorectal cancer is a disease which can be cured, very cured. Let me share with you two examples. I have many patients. We really treated colorectal cancer, and the outcome is very good. I have a lady. She was 20-year-old female, and she came 2019. Then was complaining of bloody stool. I have a friend of mine who was actually working at St. Mary's. Then he did a colonoscopy where he concluded there was 1,000 polyps. And we took a small pieces, then we sent in the lab for analysis and to confirm it was a cancer. So I repeat colonoscopy myself. Then after that, we remove all the colon where there was polyp. Actually, we did what we call proctocolectomy. We removed the rectum, the sigmoid, descending transverse, and ascending colon with cecum. And actually, we brought the small intestine in the rectum. Now the patient is doing fine. We are doing checkup every 6 months. She's doing fine. This is one. A second one is a lady who was 68, who had a cancer. Her cancer was actually located on sigmoid, as I told you, at this level. Then we did surgery. After surgery, the patient went through radiation therapy, and actually we are doing a surveillance, checking about what we call carcinoembryonic antigen, and it is low. The patient doing fine, doing well. So although I have really bad some experiences where we make diagnose one patient, 2020, and the patient went home. Actually, the cancer was located in the rectum. After confirming it's a cancer, the patient, I don't know, went for chemotherapy, but didn't finish chemotherapy, didn't finish radiotherapy. And the last week, the patient came in bad conditions, very sick. I think the patient may not survive. Let me talk about survival rate. We consider survival rate in a interval of 5 years. So if the cancer was diagnosed early, the survival rate is around 61. It's not much big. But if the diagnosis was done earlier, the survival rate within 5 years, it is 92-93%. Let's explain you if we talk about survival rate, we take 100 patients whom the cancer have been diagnosed, and if we take 100 patients, 91 patients will be survived within 5 years. So this is a good outcome. I will say the good treatment, if it is done earlier, of course diagnosis if done earlier, treatment earlier, the outcome is wonderful. Is a disease can heal well. Yes.
So that one you involve people and helping them that in case they have such kind of signs, they just come forward to the health clinic, especially the St. Mary's Mission Hospital, because I believe you offer the best, and they can be having those.
Yeah, but as I told you, colorectal cancer is a silent disease. Waiting to have symptoms and signing the come at the hospital, it may be late. And most of the time we receive the patient late. I would suggest the people more than 50 years come for screening. Come for checkup. You're always, I'm wondering, I don't know if some people have a car, they will take the car for checkup, but they never take themselves for checkup. Is not clear. So people more than 50 years should always see his doctor and make a diagnosis of a possible colorectal cancer. Other people is the people who have someone in the family who has a cancer. Please come to the hospital for screening. I mean screening for checkup, and we find the cancer at the lower stage and treat it. Yes.
Okay. Well, as we know that any drug that is administered, it has some side effects.
Of course, yes.
What are some of the side effects of this colorectal cancer?
Side effect of treatment of colorectal cancer, of course. Let me talk about chemotherapy. So chemotherapy given for colorectal cancer, it has a same side effect as a chemotherapy given for any cancer. Like a breast cancer, like prostate cancer. Yeah, most of the time the patient will lose hair, and the nails can change color. The patient can increase weight or lose weight. Yeah, the side effects they are there, but most of the time the side effects they are there in the time the patient taking medication. After taking medication, the side effects are over. Of course, when we talk about side effect also about radiotherapy, is producing another cancer. This is a high side effect or cause like inflammation in the pelvic. Inflammation is a kind of adhesions are kind of poor wound healing. Yes.
So that matters for the people who have cancers and they are going under the treatment to be very consistent in case some of the side effects might appear to them. It can be prevented before.
Yeah, of course, yes. But what is always good for treatment, we need to weigh. So is there a risk factor of this patient which are bad if we consider the positive benefit of treatment? Always we treat the patient when the benefit of treating that patient is high. So let me say I have a 95-year-old female or male, very weak. So, and I will not go through this chemo radiation therapy. I will not go to surgery, because doing surgery may be having more side effects. Always we need to weigh.
And exposing them to danger.
Yes, yes. For young people, of course, we can, or some people who are very sick, let's say the people are having some comorbidities, the diabetic patient, blood pressure is high, the patient is maybe having HIV and having colorectal cancer and having COVID. So we have to think about how to deal with this kind of disease. So always side effects, they are there, but there's something that let me say temporary. Yeah.
Thank you so much, Doctor.
Karibu.
Okay, what are some of the preventive measures that can be put to prevent this colorectal cancer? Are there some?
Yeah, there is. I think first of all is kind of choosing what we eat.
The lifestyle.
So lifestyle. If this red meat, this fat food, and always when we have food, we have meat, we have to check kind of meat we were taking. And again, about the food, we have to have like high fiber diet, and we involve fruits. Yeah, it's better to mix with salad and some fruits, not only eat some food without this high fiber diet. And also meat, we have to be sure we don't eat red meat. Yeah, this is preventable. But which is preventable most is screening. Yeah, I really focus on screening. I think now where we are heading to is any patient reaching 50 have to do colonoscopy or what we call hemocult to make a screening exam to be sure the patient is not having this kind of cancer. And as I repeat, the people who has family like your dad or your mom or auntie has died because of cancer, maybe you don't even know what kind of cancer. You are in the village, but come for really screening. I invite people for screening colonoscopy. Yeah.
And talking about the invitation, when do you do this screening at St. Mary's Mission Hospital?
St. Mary's, actually what we do, there is some people who are booking for endoscopy and colonoscopy. These people are there. But we do endoscopy and colonoscopy Tuesday and Fridays. And before doing colonoscopy, there is some medication we give you so that it can clean the intestine. Yeah, you can come. I invite anyone really to come for a screening colonoscopy. Yeah, any day to be booked and actually to be done Tuesday or Friday. Or we have a SOPC, what we call surgical outpatient clinic. We do Monday and Thursday. You are welcome.
When we talk about, let me take you back a little bit, the lifestyle. You find that any type of disease, let's talk about hemorrhoids, the same case comes with the lifestyle. What do you advise people with, let's talk about the patient who has this colorectal cancer, and even for those ones who might be exposed, what can they do?
I think only thing is to come and see the doctor. And come and see doctor for sure. And always when we suspect a cancer, of course we do this colonoscopy and we take a biopsy, a small piece of the tumor, then we send it to the lab. Sometimes it becomes a benign tumor, there is no cancer. I think always I advise people to go to the hospital. I think it's the only way, yeah.
But you find some people are very afraid because they hear from other people that, or maybe let's say from the village, screening is painful.
Yeah, it is.
What do you have to say about that?
No, it is painful, but we give actually what we call sedation. The patient will go asleep, then we do colonoscopy, and after 20 minutes when he wakes up, there is no pain. Yeah, I did myself, there is no pain. Yeah.
So I think that we say with the quote that prevention is better than cure. You don't have to wait when you are 60 to have this colorectal cancer. As early as you are from 50, you said the age of 50. Just go for the screening, and you have heard that St. Mary's, they have the right doctor. We have Kazoya here, and you can book at any time to have this screening just to make sure you're very okay, instead of staying there saying I might be having this, I might be having this, just to be very assured.
Exactly. And don't wait for symptom and sign. If for example colorectal cancer, if the tumor is big, it will kind of obstruct the lumen. If they obstruct the lumen, the patient will vomit, and the patient will not pass the gas in the stool, and the patient will come in the context of intestinal obstruction. Always this is advanced. Advanced, I mean what? Normally colorectal cancer, it can be local only, or can be advanced, like let me say, in the abdomen, making what we call lymph node, a small tumor in the abdomen, inguinal area, or it can be located in the liver, and later in the lungs. So the patient at this point, we cannot manage well the patient. When you come late, the treatment is hard and the outcome is not good. Better come earlier to make a diagnosis and a good treatment.
Wow.
Yes.
Amazing. And before we wind up, I don't know, doctor, if you have something to talk about general on this colorectal cancer. Do you have something to say?
Yeah.
Your parting shots?
Yeah. Colorectal cancer, as I said, is a silent disease. Many people in the village, they will die and they really don't know from what they died. So let me consider some countries, developed countries where they do screening. They will find a cancer at a lower stage, which is treatable, and outcome is good. And in Africa, we are not there, but I think is where we are heading to, where we are going to do a screening colonoscopy. Myself, I have seen some patients at St. Mary's from 2019, only 2 patients for a screening colonoscopy. Other people, they will come when it is symptomatic. Please, I beg you to come earlier, because as a doctor, we are happy to have a good outcome. Yeah, I don't know if there is another question.
No, that one is very okay. Thank you so much, Dr. Kazoya, for making time just to make sure that our viewers, people out there, they have the right information and they have something to learn about. They don't have to wait for the last time when it's very, the signs and symptoms are, have worsened. The loss of weight, it has drastically gone down. So as we talk about weight, do you have to say if a person loses a large amount of weight, can be at higher risk of having this colorectal cancer without being anemic?
So, yeah, always a patient with a colorectal cancer will never come having anemia, loss of weight. There's some people who have weight is okay, but they have colorectal cancer. And there are some people who lose weight, they don't have colorectal cancer. So I want to mean that the patient, I see a patient who is more than 55-year-old, and he's reporting loss of weight, and this patient I don't have any explanation of this loss of weight. Most of the time, I do hemogram, I check for blood is down, and this is colorectal cancer until proven otherwise. So I will do colonoscopy to see what if I think it is there, and most likely it is there. It is really common. People will think this colorectal cancer, let's meet at St. Mary's, we do like endoscopy and colonoscopy, 200 patients per month. So I think I'm able to identify at least 10 patients per month who has colorectal cancer. This is a lot. This is a lot. And most of 95% is advanced disease. So for sure that's why we need to know it is real. And cancer, is a disease it can heal well. So the people need to come just hospital for treatment. Yes.
And does this colorectal cancer, spread to? Can it cause maybe someone to have other cancers in their bodies?
Of course, is what I told you. Yeah, normally there is what we call is a big thing, TNM classification. No? At cancer, we have what we call first location. The first location for let me say colon cancer, it is in the colon. Then it can spread. They call by lymphatic system. It will make what we call lymph node. You can go check up in the inguinal area. There is a growth. Please go for checking a possible colorectal cancer. This is one. As I told you, through blood also, systematic, the blood supply, you can have also, this cancer is located in the liver or in the lungs. Most of the time of these people, we talk that colorectal is advanced. It is associated with a lymph node cancer in inguinal or in the abdomen, a hepatic cancer in the liver, and the lungs cancer also. It is, if it is advanced, it can be located in different sites. Yes.
So it's very harmful. One has to go to the health center. What about, are there some of the self-treatment maybe one can do apart from monitoring due to these signs and symptoms?
Not really. I think self-treatment, like what you feel. Sometimes what is happening in the health center, a patient is losing blood. Then he is admitted, you give blood. So you are treating the symptom, but you are not treating the cause. So this is temporary. Is good, but we have to find out why the patient is losing blood. So although the patient is having annual pain, then if we go to pharmacy to buy pain medication.
True.
Yeah, the pain can subside sometimes, but you are not treating the cause, you are treating the symptom. I will invite people to know why the patient is feeling pain, and treat the cause. It means is a kind of definitive treatment. Yes. Or a patient who is losing weight and he's 60 years. he has lost like 10 kg within 2 months, and go to the dietetic people and they will give him food, good food, so he can increase the weight. It's okay. You are treating symptom, but you have to find out why this patient is losing weight. And by doing like investigations, a colonoscopy and CT scan. So it's better to know always the cause and to treat the disease at the root, not just to treat symptoms. Yeah, is what I can advise people.
Okay.
Thank you.
Well, thank you so much, Dr. Kazoya, for making time, as I said, to come and to share these with our viewers. And I'm sure that they have been able to learn a lot on this topic, as I have too, and we appreciate your time and for making this effort to come and do whatever you're doing. And thank you to the whole team of St. Mary's Mission Hospital for having thought of these, for sharing your general information to our people out there. Thank you so much, and may God bless you.
Welcome.
Yeah, and thank you so much to our viewer for following always this health talk right here on Capuchin TV. That is every Tuesday. And make sure that in case you miss this topic, you can always follow it up at night. That is from 9:30 p.m. and also in our Facebook and YouTube page. It's always there. You can always catch up with us so that you don't miss something that we have talked, because we won't repeat it on coming next week. And thank you so much for joining us, and thank you so much, and wishing you a blessed day. And also, as you prepare yourself on this Easter season, right?
Yeah, yes.
It's almost appearing. Make sure that whatever doctor has said about our lifestyle, whatever we eat, I know after Easter people will just have the meat celebration, you know.
Yeah.
So be careful, and wishing you all the very best. My name is Maureen Kimani, and in the studio we have head Dr. Kazoya from St. Mary's Mission Hospital, who is the general consultant surgeon. May God bless you and have a good day. See you next time.
Thank you to have me.
You're welcome.
45 minutes is quick.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.